Thank you, Madam Chairman. Governor Whitmer, I'm going to direct my questions all to you, and I got three questions, and then you can answer those in a follow-up after that. Governor Whitmer, you have been openly critical in the media of the Trump administration's response to the pandemic. With all due respect, let's take a hard look at some of the actions that the Trump administration and CDC have accomplished in chronological order. On January 7th, they established a coronavirus incident management system. On January 17th, they began implementing screening at 3 U.S. airports. On the 21st, they activated an emergency operations center. On January 31st, the Trump administration declared the coronavirus a public health emergency. Then followed on March 12th, the World Health Organization declared that the COVID-19 is a pandemic. The following day, the president declared a national emergency. But Governor, you hesitated, and according to the Detroit Free Press, you waited till March 26th to ask for a federal disaster declaration from the president. So by the time you asked for that declaration on March 26th, 12 other states had already requested and had been approved for that. And almost 60 Michigan residents had died of COVID-19. So in this two-part question there, Governor, do you regret not acting sooner? And secondly, remember that 12 other states had already acquired disaster declarations. Do you think Michigan should have been put in the front of the line and ahead of these other states relative to the federal stockpile, the SNS? Second question, Governor Whitmer, on March 27th, you told radio station WWJ 950 that Michigan was in trouble getting the equipment they needed because you alleged that the federal government was telling vendors not to honor the contract they had with Michigan. These are serious violations or allegations. Governor, will you release the names of who those vendors were? And then the third question, Governor, according to the Washington Post, more than 25,000 nursing home residents and more than 4,000 nursing home staff have died nationally. That's 25% of all the COVID patients. And as of Friday, at least 1,216 nursing home residents have died from COVID in Michigan, which is about a quarter of your state's total. Other states have instituted mandatory testing of nursing home residents and staff, but apparently you've not. Why not, Governor? Could you answer those questions, please?
Congressman, thank you for raising these questions. And with all due respect, I'm not going to go toe-to-toe with you on every allegation that you've alleged. I will say this, though. The United States lost valuable time in the early days of COVID-19, when we could have been planning, when there could have been a national strategy, when the use of the DPA could have been used not for meat production, but for swabs, which we still don't have enough of. What we know in this country is that the enemy is not one another, it's a virus, and the virus doesn't stop at state line and it doesn't stop at party line. We have to band together to address the crisis that has ravaged our nation.